Hi, I'm Jeff Albertson. I'm a physical therapist with Vasta Physical Therapy Performance Training. And today I'm going to show you how to use a foam roll to do a little tissue softening front and outside of your thigh. This video is linked to a blog that we have talking about iliotibial band syndrome, but the usefulness for these techniques for improving the mobility and flexibility of the muscles and fascia in the front side of your thigh. It can be useful for a lot of issues that we see affecting knees, hips, lower backs. So let's get started. Foam roll on the side of your thigh. We'll go over just one or two real basic and easy strategies. Best place to start is to put the foam roll dead center of the thigh, not up on the hip, not down on the knee, but dead center. You're going to cross the other leg over, and you're going to weight bear through this foot, this hand, and you're going to put as much pressure down on this foam roll as you can with a reasonable amount of comfort. What I mean by that is, this is not always the most comfortable thing that you're going to do. We don't want you to be in a ton of pain. We don't want you breaking out in a cold sweat. But if you can relax, even if it is a little uncomfortable, if you can convince yourself to relax and let these muscles relax and soften over the foam roll, a little bit of discomfort is okay. And a decent amount of discomfort is even okay. So, first place to start is maybe 6 or 7 rolls up and down the iliotibial band, the very dead side of your thigh. We want to avoid rolling up onto the knee joint itself, and we want to avoid rolling up onto the bony bumps on the side of your hip. So give yourself a finger or two of kind of safety zone between the joints and where you're putting a lot of deep pressure on the foam roll. We want to make sure we're in some meat there. After going dead center of the thigh, the angle forward about 45 degrees. Now we'll put our other hand on the ground. I'm going to keep my foot off the ground and kind of go up and down the side of my thigh. So now, instead of the very, very outer edge of my thigh, I'm really up onto my quadricep muscle, which is the muscle on the front of your thigh. I'm just rolling out the outside portion of that muscle. So again, maybe 6 or 7 times up and down, avoiding pressure on the knee joint, avoiding pressure on the hip joint, a little bit, or maybe even a moderate amount of discomfort. If you can relax and soften through it, it's okay. You want to avoid outright pain. You want to avoid pressure on the joints. Last, we have a muscle on the side of our hip. For the sake of discussing iliotibial band syndrome, if you put an imaginary line down the center of your hip, and we think about the muscles that are on the back side of that line, and then there's muscles on the front side of that line that both contribute and attach onto that iliotibial band. So one of the muscles that we're really interested in is this muscle in the front called your tensor fasciae latae. So if you think about the bump on the side of your hip and the hip flexor or the hip pointer bone on the front of your pelvis, this is this little tiny bit of muscle that sits kind of right in between those two bony bumps. So when you're doing it on yourself, you're going to basically go from your iliotibial band, then you're going to skip over hitting the bony bump on the side of your hip and not roll over that. Lower yourself down on this elbow, and we're going to keep ourselves angled forward about 30 degrees or so. I've got this hand down. Now this is a small muscle, so I'm only going to be rolling up and down about 1 inch or so. If I roll too far, I'm now up onto the bony ridge of my pelvis, and I'm putting a lot of pressure from that foam roll onto those bony bumps. It's probably not going to hurt me, but it's not achieving anything and it's uncomfortable. If I get down in between that bony bump and the bony bump on the side of your hip, so in between these two bones, I've got a strip of muscle of about 3 inches in length, and that's where I want to be. 3 great spots to work on a little bit for softening up tissues that can tension and affect mechanical strain on that iliotibial band.